Welcome back to another episode of Sports Medicine on Tap. My name is Brandon Align. I'm sitting at Neck of the Woods Brewing Company with my good friend Dr. Frey on a beautiful Tuesday evening. Dr. Frey, what's going on?
Not a heck of a lot. All's well, man.
All is good, right? It's funny, we were joking before we started the show. It was like, tonight might be the night that Brian gets to sit down with us at the bar, at the table, because Neck of the Woods was a little quiet when we first set up and then we had our pre-show beer, and then as soon as we finished that one, the room started to fill up.
I know.
And Brian's got to go do his job.
Literally, I don't know, and I guess the people who are watching on YouTube are going to see, I had a big grin on my face as we got rolling, because it was exactly that. I was looking back to see, is there any chance Brian's going to be able to jump on with us tonight? And I look back
the bar's full and everything. But I will say, give a little shout out to Brian. When I got in tonight to set up, he goes, Brandon, you don't have a choice in what I'm giving you. I'm just going to give you something. And I'm like, oh, sure, whatever. He goes, you have to guess what it is. And it was one of the newer watermelon lime sours tonight. And man, that was delicious.
Tasty, right?
And it's just, again, just baffled by Frank and the brewmasters back there. They just put some stuff together. And it's just
amazing.
It's too good.
Yeah, and now we go with a little curveball, going with seltzer.
Yeah, now we went with a seltzer. We went with a transfusion seltzer, which I believe they posted on their Instagram story. So it was a little social media, I think, influence on my decision on that one.
Yeah.
And I recently had it not too long ago. I tried one of their 4-pack seltzers that they had here, a little variety pack, and it was really good. It was one of the better ones in the group. So I was like, I'll go with that again. I'm
one of the odd kids that grew up loving grape juice. I don't know why. I love it. Like that was like grape juice.
Grape juice,
that's
right?
One. Yeah, and it does. It tastes an awful lot like that, but seltzery, little, and delicious.
Can't beat it. So we're back. We took a week off. Last week I was down in New Orleans at the NATA National Convention for Athletic Trainers.
Nice.
Good old time, first time in New Orleans. So it was a heck of a good time. My wife and my son also went with me, so it was a little family vacay. Got to get good education, some good lectures, some really good presenters. Got to meet a bunch of people, so it was a good time.
Yeah.
Obviously, we had to take a break from this, but now we're back. And in the mix, we missed some things, and we have some things to talk about tonight. We don't have a direct focus.
Yeah.
We kind of have a
few different topics.
A little shotgun approach tonight, kind of cover a bunch of different things.
Sure.
And it was kind of like when I was doing the research for tonight, it just kind of snowballed, and I kept finding little gems of like, oh, we should talk about this. We'll maybe chop this up a little bit and see what we're going with.
Yeah.
But now we're in the kind of a slower season in professional sports right now. The biggest thing going on is professional baseball with the MLB.
Yeah.
We've mentioned before the Olympics are coming around the corner.
Yeah.
But, the NBA and the NHL finals or the Stanley Cup finals have all wrapped up. And, Boston Celtics have been crowned and the Florida Panthers have won the cup.
I know.
And it's like,
what an exciting comeback by the Oilers, though. They came up short, but man.
I know. I mean, the best two words in sports is Game 7, right?
Game 7, yeah.
You can't beat it. And that was one heck of a game.
That and playoff hockey. What a great
playoff hockey. And, obviously I'm a little biased in that Philadelphia Flyers haven't been the best in regards to hockey. But when it comes to playoff hockey, just the intensity is way it's just all or nothing. Those guys go and give it their all. And just hockey's just so tough.
I know.
And it's just so tough. And it's just like they do all these things, all the hand-eye coordination, all the physical attributes, while skating on ice and balancing, and it's just like that's enough for me. It's like, holy cow.
And I feel like it used to be like these guys are amazing, these guys are great, what they can do on skates, but now like the shooting and knocking the puck out of the air and like redirecting, like it's a whole nother level of ability. I mean, really like just incredible. And with hockey, a joke. And actually, I'm going to talk a little bit about the CONCACAF Cup or CONCACAF, and but like with soccer, right? Like, people don't score frequently. Right. And so when they score, it's a huge ordeal. The opportunities to score aren't many in a soccer game. There's a few, and so there's a few moments of like, and but then in between there's a lot of like downtime waiting, right? And then I would say basketball is the exact opposite. They score every 15 seconds, and so the each basket sort of has a little bit of less significance, right? Hockey is just this beautiful combination of they're always about to score, but it almost never happens. So you're on the edge of your seat when these guys are playing on that level. Like you're on the edge of your seat the entire, especially like if you have a vested interest, you're rooting for one.
Correct.
Like, oh man, it makes it a very, very exciting sport.
Yeah, when I cover soccer, and it's like soccer's a sport of like so many almost cool things happen all the time. It's just like, oh my God, he cleared it. Oh my, almost hit a bicycle. Almost headed it in. So close. And like you said, similar to hockey, but it's just so much more condensed and just so much fast paced. Those guys are doing quick shifts and they're coming off and a whole new line's coming on.
Yeah.
And then you have, the goons coming out and they're just beating the crap out of each other.
Right,
and then, you get the benefit of fighting in the sport too, which
It's
is
a
just
plus.
so brutal.
I know that they have a penalty.
Yeah.
Like for fighting,
Yeah.
like actually fighting. Right?
You can just throw them down and take care of business and then keep on going.
And it's sort of an accepted thing. The refs like understand like this is part of the culture.
Yep.
Get your fight done, and then we're gonna
Right.
jump in, and then like, all right, now you're past
Yeah,
it.
and I covered hockey in grad school. I was covering club sports, and we had 3 different levels of hockey team, like a varsity, a JV, and a women's team. So it was interesting to really like be on the sidelines and really like understand the culture more outside of being on the bench is like one wild place.
I'm sure,
It's just so much, just so tough. And
Intense dudes.
how many times have you seen the videos of guys getting big lacerations on their lips to get sewed up and they go right back out there
Yeah.
and like other stuff? It's just so tough. And
Hockey tough.
and it was just a different kind of toughness, obviously. But like you said, it's just the Oilers made it really good,
exciting.
really good series out of that,
Yeah.
pushing to Game 7,
Right.
and came up a little short. And it
Yeah.
was, I think I caught almost most of the third period, but I was really I sat down finally for the final 8 minutes.
Yeah.
Oh my goodness, it was going nuts.
It's intense.
My wife was like, "What are you screaming about?" I was like, "I don't even know. Like this game is so intense. Like
Yeah.
I have no vested
You're drawn
interest.
in.
I don't care who wins, but I just want someone to score. I want something cool to happen." And it was just a barrage of shots on certain goalies and whatnot, and it was just incredible to watch, and you can't beat it.
And I would say now the opposite, and it's actually pretty intense, and there's a lot of collisions, but watching soccer, did you watch the U.S. get knocked out of the?
I didn't.
Uruguay.
I kind of caught the highlights of the USA game that happened. I think
Uruguay.
Yeah,
yesterday,
against Uruguay. Yeah.
So I will say the first 10 or 15 minutes of that game were great. It was really good soccer, and it was intense. And actually, the U.S. was dominating that portion of the game. But that's not what made it exciting. Is they were playing. It was exciting, and then it turned into what a lot of people think of as a soccer game. One, either the ref was terrible or the ref was extremely biased, and I hate to go to that,
Right.
but it was like dramatically obvious. A lot of terrible calls, and almost like bending the rules kind of a thing, where he goes to pull out a yellow card, and halfway through pulling out the yellow card, he holds it, puts it back down, because Uruguay all of a sudden has a break and says continue play, and then afterwards it's like, you're getting your yellow card anyway, and it was to the point of
whoa, what's going on here?
what's
right?
happening here, right?
Yeah.
Very bad. And but separate from that, the game turned into that first 15 minutes are great, right? It's 2 minutes plus injury time. So typically it's 90 minutes, an hour and a half. And I would say in the excluding the injury time, the other whatever it winds up being, 75 minutes, there's probably 30 minutes of soccer. It was just guys rolling around on the field, claiming that their arm just fell off or the leg just fell off, and part of it is they want to slow down the game. It's not even they're trying to get the call. Uruguay just wants to slow down the game. That's all they care about. And for as long as they're rolling around on the field, the game is being slowed down.
Milk the timeout a little bit, keep your lead. Right?
Yeah. And even right down to a throw-in, right? This guy's kind of standing there and he's dribbling it, and then he's like, oh, I got to tie my shoe. And then he throws it to the next guy who's standing and figuring out where he's going to go. Every minute of the game is, and I get it, it's strategy. That's how you win.
Right.
But it would be so much more exciting if they just actually play the game.
As a fan, you want
fan,
to see.
just
That's
play.
with all sport, right? You want to see the action. You want to see all the
Right.
fun stuff happen. But when you see the strategic part and the slow down, it was very similar in football. The thing that they milk the clock, they run the clock out, and I was like,
But it's within reason. It's
Within
not
reason,
you
right.
can't just fake stuff. You know what I mean?
Right.
And that's what a huge portion of this game is.
Yeah.
I don't know how you do, but I wish there was a way to get that out of the games. Give an unbiased ref the ability to be no.
Yep.
I don't believe you. You're out.
Right.
That's it.
Yeah.
This way, people would be less inclined to do it.
Well, yeah, from an athletic training standpoint too, is when I cover soccer, it's all right, you got to really one, it's always good to know your athletes that you're, that are for your team, and you kind of tell them look, if you're gonna go down there, do whatever you do, but you got to give me a little sign, give me a little thumbs up, slap it down a couple times, but, just let me know. Let me know it's just you're selling it a little bit, and that's okay.
Yeah.
And, whatever, it's the strategy of the game, go for it. But sometimes you're always on your edge of your seat, especially earlier on my career. It's oh man, they're down. Oh, no, they're fine. They're walking off. They're or the infamous the World Cup, they bust out the cold spray and they start spraying everything.
I know, it's a joke around all the time.
The cold spray.
There's the spray. Oh, the magic spray is better.
The magic spray, you gotta love that too, right?
Yeah.
So it happens. It's the nature of the beast, if you will, and It is what it is.
And what is a little bit frustrating too is, and my son who plays soccer now as well, and like at a younger age, and like it's part of the game. Like the kids see it, and that's part. And
Right.
so like at one point he's a goalie, and a kid my son goes out to save the ball, and he goes sliding in to grab a ball as a the other guy's bearing as the forward is bearing down, or the attack is bearing down, and my son gets to the ball first and slides and grabs the ball, and the kid's yelling at the ref, he came in with his cleats, his legs are up, he came with his cleats, and my son was like, oh boy. And after the game, literally my son, like he's just a nice kid, he's like, hey, I'm sorry, I didn't mean to do that. And he's like, oh, I know, like I was just trying to get a call, like you didn't do that at all. And like I don't know, like for the love of God, these kids are in 8th grade, like
right. It's funny how you so many things that you see, kind of like we touched on earlier, like the changing like a little bit of the sport. It's just like you see that finesse a little bit more across the board, whether it be hockey with the tip-ins and the fancier stick skills, and with the basketball now. In basketball, you way more 3-point shooting, way more like shot creation, other things like that, versus like back in the day it was more aggressive, drive the lane and just go up for the layups, get the foul, and go for it.
Physical game,
much more physical game. And now, as everyone can argue some, the old school people of basketball, like, oh, the game's much softer now. And it's like
that's what they say.
Everything's ticky-tacky and all the fouls and stuff, which is, it is what it is.
Yeah. The level of skill has just gone through the roof, right? Like
And just all those guys and girls who play the sports that we're discussing, they're so good now. It's just the level of mastery that we get to witness now. It's just through the roof. It's way different than before, and I think that's why you see a change, because there's so many more options, so many different ways to score. There's so many different ways to achieve the whatever you're trying to do. Drive the lane, whatever. It's way different.
Right. When we were in Spain, I mean, we're getting really down the road.
Oh, we're all over the place right now. It's okay.
But when we were in Spain, we were there not too long ago on a family vacay. My son and I were actually walking out of the hotel we were staying in. We were in Sevilla at that point, and two guys. They looked like kind of teenagers, and I guess late teens, maybe early 20s. And they come walking. They're walking down like kind of this square. There's a main area, and they plop down. And I guess they're doing to try to get some people to give them some money and whatnot. And so like they drop down a radio, start playing some music, and they're basically doing like tricks they can do with soccer. And like I was blown away by the ability, on handstand, like ball on top of his shoe, and then like roll it down like the leg and onto the back, and then like flip it back up, and like to watch them dribble and like watch the control and watch these tricks. And part of me was like, is this sort of the standard, in Spain? Like, but then, and of course it's not, but like just to see like the extraordinary, like circus act kind of like ability, like amazing. And this is just like two guys that are out there doing it.
Right. And that's like the level of just, a random street performer in Spain versus like, imagine what if you could just sit down with like Messi or Ronaldo and see what they could do, just like what kind of crazy tricks. I'm pretty sure I've seen videos.
The level of play.
I think of Messi who dribbles around his gigantic. He has like a gigantic wolf-looking crazy dog, and he just dribbles around and jukes his dog all the time.
Is that what he does?
And it's like, well, I mean, if you can dodge that gigantic dog, you can probably dodge some really professional sports soccer players there.
Yeah.
But to get us a little bit on track, we just want to give a quick shout out to our sponsors at Virtual Orthopedics and Spine. From runners needed dog walkers hip to yard work back and laptop wrist, they've got a doc for that. Find the right specialist for you at virtua.org/ortho.
Got my virtual gear on.
There you go. You're rocking the good stuff now. Like we mentioned, we kind of mentioned a little bit of a recap of some of the finals. I think the big story of the NBA finals, though, was Kristaps Porzingis from the Celtics.
Yeah.
It's funny that it's when things happen in the world of sports media and whatnot now, especially in this position that we have, when you see anything that's new, exciting, or rare, it's rare.
Yeah.
I saw the ESPN notification. Porzingis has a rare injury. I'm like, well, I know I'm going to be talking about that soon. We got to click on this link, and just the way the schedule was, we weren't able to record a show, and unfortunately tonight we weren't able to get our guy Dr. Brand on to talk about this.
Coming back from Boston, he was hoping he was going to make it, but
Ironically, he's probably up celebrating with Porzingis up in Boston, having a good time. he might have fixed his problem.
That might be why he was up there.
He got the special call. So it came down in Game 2 of the NBA Finals. Was reported as a torn retinaculum and dislocated posterior tibialis tendon in his, I don't know, left or right side, but one of his ankles.
Right.
And I was like, oh, that's definitely different. That's something that we definitely haven't talked about. We don't really, I haven't seen it in my clinical practice yet, and I'm 10 years in or whatnot. But it's just like, okay, you got our attention.
Yeah, that's exactly right. And so and truth be known, I don't know too much about it either. Mm-hmm. It is. They weren't kidding. Kind of a rare injury.
Right.
So I did a little bit of a dive, did a little bit of research to read up on it and figure a little more out. And, so there's another entity out there that is not uncommon, but it is a separate entity. It's different. So your posterior tibial tendon. It's a tendon for one of the muscles that's basically in your calf, kind of on the inside portion, a little more towards the back, called deep posterior compartment.
Right.
And it goes down the back inside of your lower leg, and you have a tendon that wraps around that little knob that's on the inside of your ankle, your medial malleolus. And my former resident would freak out. Like, this is his thing, malleolus. He would that's not how you pronounce it, malleolus, is it? But whatever, inside of your malleolus. And it goes and it attaches to one of the bones in your foot. Actually, it's a couple, but really the main attachment to the navicular. The one that was a problem for Embiid. He had that navicular fracture way back when we first got drafted.
Right.
So that's the bone it attaches to, and that muscle, that tendon, it does basically three things. One, really, it helps you point your toe down. Number two, it helps with what's called inversion. So like if this is your ankle, kind of in to the side, help the guys on YouTube. But so in like medially or into the side, kind of towards the other foot. And then the third thing is that it helps maintain your arch. Right. Because of where it's attached. So in this other entity, in the posterior tibial tendon insufficiency, basically, as you get a little bit older, it begins to wear down with time. It begins to break down. If an adult has what we call fallen arches, acquired flat foot, so later, like they didn't have flat feet, but later in life they develop flat feet.
Right.
Usually that's why. It's that particular tendon that's beginning to stretch, beginning to fray, and cause all these sorts of issues. And it can be a real problem. Sometimes leads to some pretty big surgery in order to try to correct that.
Yeah.
But this is not that. This is totally different.
Right.
And so I guess what they were saying with this particular injury is that tendon, which runs right behind that little knob on the inside portion of your ankle, slides out. It's kind of like you have a traumatic injury and it slips out, and now it's sitting on the side of your ankle instead of behind that knob anymore. You've never seen it either?
No, I haven't, but I've seen a lot of different injuries or pathologies to that tibialis posterior tendon. It has, like you said, it has a lot of role in that foot arch, and a lot of times you see it, at least weakness or an issue with it with runners with like shin pain or whatever. It's 'cause, when they're running, that muscle doesn't have enough ability to hold up that arch to absorb the shock of running.
Right.
So then the arch comes down, and that shock is going up through the bone of the shin.
That's
then you start to develop shin splints, and then that can turn into a stress reaction, stress fracture, and then God forbid you don't hope it doesn't turn into a full-blown tibial fracture.
Yeah.
And it's just one of those things, you see it a lot.
Yeah.
And but like you said, it's a big issue when it comes to the foot arch.
Right.
And so with that being said, it's like it has a big role in just your normal gait, walking, and all that stuff.
Absolutely.
And it has like you said, it moves in plantar flexion, inversion, but also kind of has like stability of like holding that arch up.
Yeah.
And that's so important for so many different things, especially if you're
tripod of the foot,
a gigantic, tall human playing basketball, jumping up and down a bunch of times, trying to win an NBA title. So it can definitely be pretty impressive that I think it's impressive. Well, what I was going to say is I think it's impressive that he only missed 2 games with it. And somehow managed to come back and play Game 5. And again, I think it's one of those things that we've touched on before. In those situations of sports medicine, is where you get those little opportunities to push the envelope just a little bit.
More so than you would.
And I think the telltale or stories, like if we're playing for a championship and this is the last option we got, and we're going to just go for it and give it all you got, this is what you do. And what did he do? Game 5, Boston needed one more game to win. To win a title.
Yeah.
What do they do? Who knows what kind of treatment and other things he did? Some kind of crazy tape job to at least to kind of secure that tendon from popping in and out too many times, I guess.
If you can.
I don't even. I don't even know how it would work.
You can. I think that so. Let's say if and again in this other entity, posterior tibial tendon insufficiency, there's some very very restricting kind of braces or boots almost that you can wear that will take some of the stress off of that. Now in this situation, I wonder if he's just so tall.
Right.
He can still be moderately effective without as much of an ability to jump, and you put him in one of these restricting braces or something or other to just try to get him through the game. And he's a presence at least on the court, right?
Right. And I mean, having him out there is probably better than not having him out. He's still going to draw a defender who's going to respect his level of game.
Yeah.
And that just gives the opportunity for everybody else on the Celtics to do well.
Right.
Jaylen Brown, Jason Tatum, like those guys probably, they had their opportunities because Porzingis is on the floor.
Directing traffic, redirecting, whatever it is. Yeah.
Or, just being enough of a distraction, or at least, you can't just ignore them.
Rebounding the ball,
right.
doing,
Just enough.
Yeah.
Just enough to make everybody else on the team really well.
Yeah. And a big part of his game is height, right? So he still has that height, even if he can't jump as high as you want to.
Right.
He still has his height.
You get good positioning and can box out a little bit. You can do really well on the rebounding walls.
Know what I thought was interesting is that I think he wanted to also play for I think he's Slovakia
or Latvian. I think
Latvian. That's right. And he wanted to play for the Olympic team for Latvia, and they basically said, well, you can't really play up to your normal level of ability if you play with this injury, and he's going to opt not to do that.
Right.
You got to wonder how much pressure is coming down from the Celtics.
Right.
You're under contract. We want you for next year. We don't want this to get worse.
Right.
Do not go play.
Yeah, we're paying you millions of dollars.
Right,
You're going to get this fixed.
Go say what you want to say, but I got to imagine
And I get it. I mean, it's a terrible time to get injured. Right?
Oh yeah.
Think of it from his perspective too. It's he just won a championship.
Yeah.
How great would it be to not ride off, he's not retiring, but just go on to the next phase and go play
get
for your
this
team.
Too. Possibly once in a lifetime. Right. Yeah.
Right. Because who's to know where he's going to be in 4 years from now for the next round of Olympics?
Right. So with that in mind, where will he be in 4 years? What kind of an inch? So from what I've read, and again, it's not like there aren't a ton of these reported.
Right.
It does make me wonder every time we find out about something that it doesn't happen that frequently. It always makes me wonder, did it mean that I not see it? Have I encountered it? But because it's not really a common thing, it wasn't even in my mindset. So just in terms of symptoms, so people are kind of aware.
Right.
And, a little bit of weakness, I think, is the issue. Typically, it's like a rolled ankle kind of an injury, and I think it gets mistaken for a sprain, but it's a medial side. The pain is on the inside. Whereas, we've gone through the whole sprain thing, the different kinds of sprains, but most of the time you sprain your ankle, it's ATFL, it's on the outside of the ankle.
Right.
So anyone who has a medial-sided sprain, I think it should be on the radar as a consideration. And then this will essentially always require a surgery. And then from a surgical standpoint, essentially what they're going to do, what they try to do is, if there's some tearing in it, they try to debride some of the tearing, kind of clean up the torn portion, slide the tendon back to where it's supposed to go, and apparently the majority of people who get this injury do have what's called a shallow groove. So there's a groove, a little tunnel, fibrous tunnel that tendon runs through. And if that tunnel is not quite deep enough, it's a little easier for that tendon to slip out of the tunnel.
Yep.
So they have to deepen that groove frequently, make the tunnel a little bit deeper, number one. And number two, we were talking a little bit before the show. On the other side of the ankle, on the lateral side, you have two tendons, your peroneal tendons, the brevis and the longus, and much more frequently associated with athletic injuries.
Yep.
You can get subluxing of your peroneal tendons or tearing your peroneal tendons, and it's treated totally differently, right? If there's with the peroneal tendons this is now the outside of the ankle, right? If there's a thin slice or a thin tear, you just trim the torn portion out. If it's 50% somewhere in the middle, you sew it back together and you do what's called tubularizing it, trying to make it look more like a tendon because it tends to flatten out before it tears. And then number three, if it's really beat up or really torn, you just sew it to the longest, to the tendon right next to it, because they do almost the same thing, those two things. But you don't have another tendon like that on the inside. You have two other tendons on the inside, the FDL flexor digital longus and the FHL flexor hallucis. But they do totally different things. So you can't just. So you really want to try to keep that tendon. It's very important to try to keep that tendon. So what you do is put it back in the groove, deepen the groove, and then you repair the retinaculum, that little thick piece of tissue that's supposed to keep it in place.
Right.
And the reports that I read is that in general, like, people do well, maybe 4 months, maybe up to 6 months, but like back to your level of sport, lose a little bit of your dorsiflexion, bringing the ankle up, a little bit of the plantar flexion. So you know, you'd like to think that this won't be the career changer or career derailing, especially if he gets to it early, as opposed to trying to get through
push
the
through it. I mean, I'm sure, you know, I think he did have surgery back on June 27th. So I'm sure that when the surgeon went in there, the damage was as it was.
Oh, so he's already had the surgery.
Yeah. So I did find that out kind of in my research a little bit. So he did have the surgery. The Celtics did report that he had it. But I'm sure what that surgeon saw when he went in there was a much better scene than it would have been come, you know, August if he had to try to fix it up. But I mean, I think the Celtics even reported he might need about 5 to 6 months of recovery time.
Yeah, that sounds about
so
right.
with that being said, you don't want to do that come August, because then that's going to put you all the way out till
missed
February.
that much more of the season.
That's a lot of time, especially when, you know, basketball starts in the late fall.
Yeah.
You don't want to do that. And I think the opportunity or like a learning point of this too is that it is the rare injury, and I think it can, like you said, it hasn't seen me before and I just missed it. It's like you don't really see medial ankle sprains often.
No.
And you know, when you learn about it, like, oh, they're kind of more rare, and they're painful because that deltoid ligament on the medial side of your ankle is really strong or whatnot. So I'm sure it's been missed before. It's like, medial side ankle sprain. Like, I couldn't tell you how many medial ankle sprains I've diagnosed in my career. Not many, but a few.
And then maybe some of those.
Right. Maybe some of them was. And I mean, I know, you know, I've had a case where we treated it as a medial ankle sprain and kind of like a bony contusion. And it was this kid he kept passing return to play testing and everything. But he couldn't get past. He was a football player. Couldn't get past like the contact. He kept just. I got hit again in my ankle and it hurts again. It's like, you just pissed off a bony contusion. It's going to hurt some more.
Right.
Here he had a little hairline fracture in his medial malleolus, and it's like just one of those things. Like it doesn't always just present. It's like, oh, hey, I'm here. It can sometimes get missed.
Right.
And it's like one of those things where you got to kind of keep it in your back of your mind for your differential diagnosis. Like, ooh, it might be one of these, and where it helps where you have a good collaboration of a good sports medicine team. You have different eyes on it. So someone else might pick it up. You might miss it. And it's like, well, good to know that it exists a little bit.
And we actually do that, I don't want to say a lot, but moderately frequently. Like whenever, you know, the kind of the docs within the group, at least the sports docs, the sports team, if we have something and like it's just not adding up.
Right.
It just doesn't fit. And you can, like you have your tunnel vision. You sort of like see what you see.
Right.
And every now and again when that happens, we'll say, you know what, I want you to go see my partner. I just want to see if he sees something that I'm not paying attention to right now. And then lots of times, like sometimes they will. Usually they don't. But sometimes, and then all right, bounce back and like. But it's very helpful to have that ability to be able to send it to someone with a fresh set of eyes and look at it from a different perspective.
And I think that's so important too. It's just like I do it all the time. Is like I'll do an evaluation on a student athlete or a patient. It's like I don't know, this is kind of weird. I'll ask someone to take another set of look at it.
Right.
And it might be something like they ask a history question that you didn't, and it's like, oh, that opens up a whole different can of worms.
The whole
hallway.
Now
you're going down this hallway of like, well, I would have got that if I asked that question, but had I known that whatever the small little symptom they were having could like, you know, pin an idea of like, oh, we should probably explore this idea. And
sure.
Sometimes it happens. But again, the team approach, I bit up my pride a long time ago. I don't mind other people checking out what I'm doing because, like, I don't know. Sometimes you just don't know.
Yeah.
And it doesn't hurt.
Or it's not clear, it's not obvious, or for sure.
And then, you know, obviously outside of diagnostic imaging and other things like that, having, you know, good colleagues to, like, bounce ideas off of is so helpful when it comes clinically because sometimes you don't think of that one thing or you miss that one little snippet of information that they kind of said. Or, you know, my favorite is like the story kind of changes sometimes when a different person asks the question. It's like, oh, you got some information that I did not get at all. You know, like, whoa, that's part of the story I had never heard before till right now. So that makes a lot more sense.
And I also joke sometimes. I'll say like, oh, they didn't read the textbook. Just what I mean by that is that it presents whatever injury it is. It doesn't present the way it's described in the textbook. Sometimes it does, and sometimes it and to be honest, it usually differs a little bit from like this way or that, and that's where the art of medicine comes in, right? Like
Right.
being able to kind of sift through like
Yep.
this isn't the factor, and this is like no, it's still this injury despite the fact that
Right.
it doesn't 100% fit the book. You know
Right.
what I mean? Like
Yeah. And that's the science and the art of it, right?
Science
Like,
and the art of it.
You gotta respect both of it, and it's got to be a good, happy meeting of both.
Right.
So yeah, I mean, we'll see what happens, and I think it'll be a good story to follow, especially come NBA season when it starts up, and see where, you know.
Unfortunately, Porzingis is sort of made of glass.
Yeah.
He's a good player when he plays, but
he has a lot of injury history.
Yeah.
I didn't even go down that tree of like looking up his previous history, but
Yeah.
he has had a lot of. I think what's also interesting is that he just came back from a calf strain
I know.
into the finals.
Right.
And I think he got 2 games in, and then he hurt. I think it
I
might have
wonder
been
if it was the same side.
I think it was.
Oh boy, here we go.
Which is, again, which is interesting,
Right.
and like we mentioned
because it is
before,
one of your calf muscles, right? Like
Right.
that's the tendon that goes through there. Right?
So, let's speculate a little bit, right?
Yeah.
Like whether if it was truly just a calf strain that he was dealing with, and maybe his tibialis posterior was doing a little bit extra work to get through some stuff, and it was just weakened.
we'll
or,
lean towards that
right,
as opposed to
it was the main cause of whatever the
the
case
actual injury back then.
Right.
Yeah.
Again, you never know, but that's one of those things where we've talked about it before of just like it just can happen, or like we talked about Rodman Acuna Jr. with the contralateral ACL going because that knee was getting overworked because whatever the case is.
That's right. That's
Sometimes the little subtle imbalances in your body can cause just a significant effect that where you push it a little bit too much, something's going to pop, something's going to go, and the weakest link is going to give out, and
that's the weakest link. Yeah,
now
for sure.
we're dealing with a new injury on top of something else.
Yeah.
So I think it's interesting that it happened the way it did, and it's like, oh man, he already had an injury, now he's getting another one. It's, ugh.
I grew up a Knicks fan, and I remember when the Knicks drafted Porzingis, and I remember him saying like there wasn't like at that point like drafting European players was starting to become a little more popular,
Right.
but at that the Knicks had already gotten burned. They drafted someone I forget, and like the knock on it was like they're soft, right? Like they get injured, they're soft, they can't play in the NBA. And I remember Porzingis like saying like the crowd response wasn't overwhelmingly positive when he got drafted. He's like, don't worry, I know the worries. Like I am going to play, and I'm going to play hard, and I'm not going to be soft. And
Yep.
and then he's off.
Then he's got a long list of time
I
missed.
know, I
Like,
know. His heart's in the right place.
Right.
Yeah, and I think he's a good player, and I think he's a good guy. But man, he's got to get on the court.
Yeah. So we'll see what happens, and I think we'll probably circle back on this story later down the line when the NBA starts back up, and kind of do our previews of the season and whatnot. So we'll see.
We'll see.
And then to tie in some other things, like I mentioned before, I was down in New Orleans for the NATA convention, and our keynote speaker was Justin Wren.
Nice.
And I talked to you about this previously before we started recording. I knew a little bit about Justin Wren prior to the NATA convention, and just a quick backstory: he is a former MMA UFC fighter. I believe he had a heavyweight title to his name, and he's now, I don't know if he's officially retired, but he's not fighting anymore. He has a new fight. And he started an organization called Fight for the Forgotten.
Right.
And essentially, this organization helps him with their primary goal is to drill water wells for the Pygmy tribe in the Congo in Africa.
Yeah.
And it kind of ties into 2 different things. He went on a long talk about his life and all these things he had. He was a UFC championship, but he was dealing with a lot of mental health stuff, which we talked about last time. With our last show with Dr. Ballard from Rowan.
Yeah.
And so it kind of ties 2 ideas. It's the mental health and the MMA world, which we're going to get into a little bit. And so Justin Wren, he was down in a very dark place. He was, mildly suicidal at some point in time, and but he came through, and then he kind of had this life-changing vision of that he was in the forest, and he went through like these trees, and when he opened the trees, he saw like a village with these people living in huts who were suffering.
Right.
And he had to figure out who these people were. He met somebody who knew what these people were, and he took them to the Congo, and he met these people, and he made his mission to fight for these people who are just forgotten. They're just out there suffering.
Right.
And he's, his goal was just to buy some land out there to help him dig a well to give him water. And now he's like exploding in that he's dug so many wells. He's purchased so much land out there to help these people, and he gave us a little insight to his Fight for the Forgotten newest project, and they just got like $1 million donation match from some very generous donor.
Right.
And they're going to be building like a community center out there, and he's dug so many wells and helping these people just get very simple life necessity of just water. And it's just the first time these people have ever had clean drinking water, just a foot, like a couple feet from their house.
Easily accessible,
not walking 6 miles to go just fill up a 2-gallon jug to kind of walk and spill some back and have a little bit for the day or whatever the case is. So he had a really great opening speech for the convention, and it was definitely emotional, and it was like it drove you. It's like, oh man, this is crazy. This is all the stuff that he could do. So again, if you haven't heard of it, check it out. Go to Google Fight for the Forgotten. You can see all his stuff. And he's been on Joe Rogan's podcast, and he has a lot of details, and his story is very well known. And it's out there that you can listen to it. So check it out.
Isn't it amazing? Like, so one, you have a guy who's pretty successful in life as it is, right? Like UFC champion, and yet still has some of these struggles. And sometimes this is what it takes: finding a selfless way to sort of help humanity. And then and then in addition to that, right, like that people will jump on that bandwagon. People want to be able to help so much that if you have a clear leader with a clear focus and sort of goal, that there are people out there, like someone who you said matched $1 million donation to help them accomplish more and to help this tribe, and it's awesome. And
it's crazy to hear a story of like how many times this guy has gotten malaria and different kind of like illnesses and stuff just because he's over there in Africa and these very remote places, and he's still just fighting for these people who need a little bit of help for stuff that we don't even think of here. And it's like, we're fortunate to have what we have here compared to them, whatever the case is. But it's just like, it was just moving. It's like, oh man, this guy just got it going on. He's doing the right thing.
Makes you feel guilty for getting upset about our first world problems.
Right, exactly, absolutely. But with that being said, to tie into the MMA part and the UFC talk of this, is that UFC 303 just kind of went over this past weekend. And really big fight, light heavyweight fight for Alex Pereira and Yuri Prochazka. I'm going to butcher the names. Crazy good fight. It's always fun in the MMA world when you get a big knockout, big head kick for a knockout in the big title fight in the main card. Really exciting. But it's good that it delivered. However, this card, when it was originally introduced however long ago, was supposed to be Conor McGregor and Michael Chandler and all these other people. And the whole face of it got changed because of injury. And when we were talking a couple nights ago, I was like, this is just interesting of just how these things kind of unfold and how these, in the world of MMA, how like such subtle changes, and it happens so quick. I think it was only less than a month ago, early in June, Conor McGregor had to pull out from this injury, or from this fight due to injury, and it was just that he just had an undisclosed injury, and it was kind of left. And then when I remembered that he was supposed to fight this past weekend, and I was like, what happened? Whatever happened to him?
What was the injury?
What was this injury? So you do a little Googling, and it comes up pinky toe fracture. And I'm like, wait a minute.
Conor McGregor?
Conor McGregor he fractured his pinky toe, and now he's out of this fight completely. And it goes on, and there's some press releases, and he posted to social media. He has a completely purple toe. He had a little injury in training. And he's taking an approach now, because Conor McGregor's worth so much money, is that he's not going into the octagon until he's 100% healthy. And he's only going to give the audience 100% of him, which is fair.
He's had not the greatest showing in the last few years, right?
And I think it was back in 2021 when he had the tib-fib fracture, and he had a significant fracture on his leg, and I think
bad injury.
And this is the same leg that he injured his toe on. So,
but I think he's lost 3 of his last 4 fights, and this is Conor McGregor, right? And he also his career to some extent has advanced beyond UFC, right? Like
he's got the proper 12 whiskey. He's got all these different endorsements.
He was in Roadhouse. He was like
acting. The guy's worth so much money.
Right. So you just start bringing up the question, like, does he need this? Is question number 1. And then question number 2, like, does it hurt him to go in the ring, not be 100% and potentially lose? Especially if he's lost the last 3 of his last 4 fights. Like some of what you have right now is because you were so dominant before, and once you start losing a little bit of that dominance, that shine wears off. I got to tell you, I heard when you first sent it to me, he's like, Conor McGregor didn't fight because he had a pinky toe injury. Like what? Is he a soccer player? No, sorry. Kind of. But I get it. I can see how it would inhibit him or limit him or whatnot. And then also, like, when you think about it in that context, he wants to be 100%.
Yeah.
He does not want to lose again.
Right.
He's, if he's picking a good fight and he's fighting someone who's tough, like he doesn't want to concede any little bit of advantage, kind of a thing.
Yeah,
but
so
it is interesting, man.
Yeah, it's interesting,
toe.
and I think there's some speculation now that he injured sometime in June or late May, so you figure a couple months, give or take, to get that healed up. And I think there's some rumors that he's eyeing up the September fight of, I think it's UFC 306, which is going to be in the Sphere in Las Vegas.
Yeah.
Which is supposed to
Pretty
be
exciting.
like one of the craziest venues that they're going to have. And it's supposed to be a really
Cool
big
setup.
fight card, and I think because I was looking this up, I got down some MMA wormholes of they might have 3 to 4 title fights in this night, so it might be like a really big deal.
Right.
So big audience, more money. Conor McGregor, more money. It all
That's where
adds
he's
up
going.
to a big return. Yeah. So we'll see what happens.
Just for the people that are out there, typically pinky toe, do nothing. Wait for it to heal. Wait for it to not hurt anymore.
Right.
It's just what it is. Sometimes you can tape it to the toe next to it. Sometimes you put in. If it's really hurting you, you can put in like a little, we call a stiff sole shoe or a post-op shoe, and buy you some time. Yeah. And I could see if it just happened, it really hurting a lot when he tried to fight, or if his opponent being aware of it, maybe it's something he goes after, right? You know what I mean?
And,
but
and I think it was funny.
Just a pinky toe.
Yeah, some of the articles I read is was this fight card cursed because the light heavyweight title fight was kind of last minute put together with Alex Pereira and Yuri, but Alex Pereira also on that head kick he broke his big toe, and it's ironic it's just the card of the toes, if you will.
Right.
And so he's seen after in the octagon he's trying to pull his big toe out because it's kind of off to the side a little bit after the kick.
Yeah.
But he's a fractured toe, as I think he reported as. So he's got to deal with that. But I mean, also that guy is just a savage, and he can just put lights out on anybody.
These guys are so
tough,
crazy,
right? And so with that being said, there's just some other things which is interesting of just the world of fighting, and just stuff can change in an instant. I know the co-main event got changed, I think 3 hours before it went on. It was late breaking news that Brian Ortega had to pull out because he was sick. He had 103 degree fever. He had some other illness kind of deal going on, whether it be the speculation that he was having issues cutting weight to make his weight class, or he just unfortunately got sick. That happens. You can catch a stomach bug going on a plane, going to the right place, or whatever the case. Right. It can just happen because they're humans too.
COVID's on the rise again. Who knows? Yeah.
Exactly. So thought that was interesting, right? You just last second got to pull out. And then in my reading of these things, I found out that Joe Pfeiffer, one of the fighters who was on the card, he accidentally ate some flax seeds the morning of the fight, and he's allergic to them. So I thought that was interesting because I was like, man, it's got to be wild to you have your guy, whether you're treating him, and I think the UFC is
there are limitations on what you can use to try to treat that.
Right, exactly, because you can't just dose them up with a steroid to calm things down, or some kind of antihistamine, or an EpiPen. You got to just have it at least medicated safely, and I'm sure the UFC has rules for all that stuff.
Sure.
So he was able to get some medication, calm the the reaction down. Ended up going out there, performing really well, won by knockout. So good for that guy that happened. But then it just sparked my brain of man, that's got to suck for whoever's taking care of him medically on the road, of being in that situation where you're you get the phone call, hey, he just ate something he wasn't supposed to. His face is blowing up. He's all swollen, or he can't breathe.
Yeah.
Oh crap, we gotta respond. Which is a little segue into our next story. And then we're all over the place. We talk soccer, we talk hockey, now we're gonna jump into baseball a little bit.
Yeah.
And this was a story that just came out. Brandon Nemo for the, I don't know.
I always say Brandon Nemo, but I actually don't know which one it is.
So either way, for the New York Mets, he was a scratch from the game last night because he had a little incident in the hotel room the night before where he fainted and fell in the bathroom and cut his head open. And his course of action was he called the athletic trainers who were on the Mets staff, and it's you never want to get those calls when you're on the road and you're just trying to get a good night's rest in your hotel room, just relax, unwind, and get ready for the next day, and you get a call in the middle of the night, something happened.
Right.
Where, I've been on the road where some things I've had incidents where we've been in a hotel where one of the room had bed bugs, and the kid wakes up and he's all bitten up,
God.
and it's oh dude, now we got to go play a football game, you got to go cover all that and sweat on all these fresh bug bites and all these different things. It's just the road stories you get of just the things that happen. But for his case, he was interviewed, and he had a good 4-minute discussion of kind of what happened.
So he had just hit his 100th home run in his career.
Right.
So as soon as I heard that, I was like, He was out drinking.
Oh, yeah, he was out having a good old time,
Yeah,
went home,
yeah.
kind of
But
stumbled around the hotel room.
He said no.
Right, and apparently he has a bunch of people that he was with that day, and that they can all vouch for him that he wasn't doing anything,
No
drinking.
alcohol involved,
And it was also, I think, in the game prior, it was just one of those hot games where the weather's been
That's probably what was going on.
And it just drained him.
Yeah.
So the story was that he woke up around 5:15 in the morning, and he said his stomach wasn't feeling too good, so he went to go stand up to go to the bathroom. When he stood up, he felt cramps in his body, and so then he went to go get some water. He got some water, continued to go to the bathroom, and then once he got into the bathroom, he said his palms got really sweaty. He felt hot, and that's all he remembers.
Yeah.
And then everything just went black.
Yeah.
And then he woke up. Then he woke up on the floor, and he pushed himself up, and he was just dripping blood everywhere from his face. He didn't know what was going on. Calls the ATs over.
What am I doing here?
Yeah, what's happening here? So they come. I assume they do some basic wound care for his head, and they send him to the hospital to go see what's going on. He had a bunch of tests done.
Yeah.
They ruled out all the serious stuff, and they just assumed it was kind of like an orthostatic hypotension situation.
Yeah.
And then he went to disclose in the interview that when he's sleeping, his resting heart rate goes all the way down to 38 beats per minute.
Not shocking for an athlete.
Right.
So for what it's worth, I loosely call myself an athlete at this particular point, but you know, like, so people who have run or have runners' hearts and whatnot, like my and I am out of shape, but because I have that background, right, like I still, like, my heart rate is typically like in the 50s, right, like just that's like my normal resting heart rate. And then if I'm cool or calm or comfortable, sometimes I dip to, especially if I'm getting into shape into the 40s. And then like at night, if I'm like hanging out or whatnot, and like if I've been running, I kind of go on spurts. I'm back in shape. I'm not like I'll be down, same thing, like down like high 30s, and so it's not. It sounds like mind-boggling,
crazy, right?
Like, yeah, but it's not that far-fetched.
Right.
But if you're dehydrated, and that's where your heart rate goes down to, and like it takes work to keep your brain perfused, keep the blood up there.
Right. In his situation, you would imagine he's lying down, sleeping, and he quickly woke up, went upright, and just a change in pressure and everything, just.
Yeah.
The light switch went off for a quick second.
And they talk about Valsalva maneuver. Like he went into the bathroom. He's going to the bathroom. And so the pressure goes up as you kind of bear down to go to the bathroom. And it's almost like blocks the blood flow from getting up to, and then like,
then you end up going down.
Yeah.
So it was interesting, and he was a scratch from the game Monday night, more or less just for precaution, right? Like the guy didn't sleep well. He was dehydrated, obviously, from his
Well, they got to do all the testing.
They got to do all the tests.
They got to make sure when he hit his head there was no injury.
Right.
Right. And then number two, like, check his heart, check it, like, are you sick? Are you, if you're dehydrated, we got to tank you back up with fluids. Yeah. So of course, and there's, whatever it is, 120-something game in baseball, like
plenty of time to
sit this
taking
one
a
out.
couple
We
games
got
off of the baseball season is not that big of a deal.
Even if the Mets are back at 500.
Right.
Even if the Mets were paying Bobby Bonilla again yesterday.
Yeah. Gotta love Bobby Bonilla Day, right?
Right.
Still getting paid. So yeah, I think we went all over the place tonight. I think we touched a little bit of everything. We touched on a variety of injuries, and we know some people who treat a variety of injuries with virtual orthopedics. They get you covered for runner's knee, dog walker's hip. They've got a doc for that. Yard work back or laptop wrist. They also got a doc for that too. Virtual Orthopedics and Spine has over 120 providers, over 20 physical therapy and rehab facilities, and more than 25 surgical centers all across South Jersey. So find the right specialist for you at virtua.org/ortho. So it's just crazy. We touch on, like I said, everything tonight, and it was one of those shows where we just shotgunned it.
Yeah.
Just put a long list of stuff on our outline and just said, let's go for the best and hope for it.
Sure.
And see what happens.
Olympics are on the horizon, man.
Oh, yeah. We're coming in hot with the Olympics. It should be interesting. We're trying to line up some good guests coming this month of July here. We're trying to get some people to get some interesting topics for the sports that we don't really cover that much.
That's right.
So we'll see what happens with that. Hopefully we have new, exciting stuff for all our fans out there and our listeners. So other than that, anything else?
No, man. See you
Pretty
next
good.
week, I hope.
Absolutely.
Yeah.
Let's set it up. We wish everyone I guess it'll be after the 4th when this comes out. So
hope you had a happy 4th.
Everyone, I hope you have a happy 4th of July, and that you had some good time with some family and friends, and got to enjoy the beauties of America, if you will. And then we'll catch everyone next time. So before we go ahead and close out our tab, we're just going to give a quick shout out to some of our other sponsors. Neck of the Woods Brewing Company, serving us up the best drinks in the area.
Brian behind the bar, who could not join us today.
Brian behind the bar, who thought he could get on the microphone tonight, but then the bar filled up. So it is what it is. And lastly, Temporary Production, helping us put all this stuff together, helping me and Dr. Frey get this stuff out to you guys, because we don't know what we're doing. We're just over here talking, having a good time.
Virtual Orthopedics.
Yep.
Yeah. Yep.
And lastly, Virtual Orthopedics again, find the right specialist for you at virtua.org/ortho. See you next time, folks.